Welcome back to the CSP Elite Baseball Development Podcast. I'm your host, Eric Cressey, and this is episode 213. Really excited for today's guest. She has been an awesome addition to the Cressey Sports Performance staff at our Florida facility. Outstanding manual therapist who has made my neck feel a lot better, on top of bringing a lot of great ideas to the table to challenge the ways that we do things and reaffirm other ways that we do certain things as well. She brings some experience from different sports to what we do with our baseball athletes, and it's led to some awesome discussions, many of which I think we'll highlight today in this conversation. So enjoy today's chat.
Overuse injuries have emerged as one of the biggest threats to players at every level of competition. As an example, at the professional level, ulnar collateral ligament injuries at the elbow alone sideline pitchers for an average of over 17 months. That's a ton of lost development and a threat to lengthy careers. Just as concerningly, though, for youth players, overuse is the predominant mechanism of injury. So what can be done? Obviously, we need to train athletes to be prepared for all the stresses the game throws at them. However, the other side of the equation, recovery, often doesn't get the attention it deserves. Healthy, recovered arms mean you can stay in the game and give your best on the field, and that's where Mark Pro comes in. Mark Pro is a cutting-edge recovery tool that provides all the benefits of active recovery, but without the extra effort, muscular fatigue, or stress to tendons and joints. Players can use Mark Pro as long as needed for exceptional recovery between training sessions or after games. We'll often send Mark Pro units back with athletes to their hotels or even have them use them on team flights. Both easy to use and portable, Mark Pro is a powerful tool that allows recovery anywhere, anytime. Use it while relaxing at home, on the road, or during tournaments. On a personal note, I was originally a naysayer when it came to Mark Pro. However, longtime Cressey Sports Performance athlete Corey Kluber turned me on to it. He adopted Mark Pro into his post-pitching recovery approach, and it was an integral part of him going out and throwing 200 innings year after year. This led me to experiment with it myself and with more of our athletes, and the feedback was consistently outstanding. Now, just a few years later, you'll see it in every major league organization as part of the routines of some of the most accomplished baseball players on the planet. If you're looking for the same results enjoyed by these athletes, visit markpro.com and use the coupon code Cressey at checkout for an exclusive discount. Again, that's markpro.com, markpro.com, and use the coupon code Cressey, Cressey, at checkout for an exclusive discount.
Today's guest serves as our sports chiropractic and performance therapist at Cressey Sports Performance, Florida. She's a board-certified chiropractic physician who specializes in soft tissue injuries, rehabilitation and injury prevention, and return-to-play programming. She also holds a board certification as a certified chiropractic sports physician. Originally from Michigan, she graduated with a Bachelor of Science in Kinesiology from Michigan State University and went on to obtain her Doctorate of Chiropractic degree from Palmer College of Chiropractic in Port Orange, Florida. She then spent 5 years working in various outpatient sports medicine clinics where she treated a wide variety of athletes. In 2019, she moved to Las Vegas, Nevada, where she spent the next 4 years on the sports medicine staff at the UFC Performance Institute. There, she supported athletes both at the institute and on the road during their fight weeks, helping them overcome injuries and get back to their journey of fighting for a belt as quickly as possible. She then went on to join the staff of the WNBA Las Vegas Aces as their assistant medical director, helping the team in their journey to win a world championship in 2023. She holds certifications in active release technique, fascial manipulation, Graston technique, rock tape, cupping therapy, dry needling, and is currently studying to become certified in chiropractic acupuncture. She's also certified in selective functional movement assessment, McKenzie, dynamic neuromuscular stabilization, and blood flow restriction training, which she utilizes as part of her assessment and treatments to figure out the cause of dysfunction and pain and get her athletes back to performing optimally. Please welcome to the show, Dr. Tera Giroux.
Tara, I know we hang out all day at the facility, but so it seems like a formality, but welcome to the show.
Thanks for having me.
I am excited to throw ideas around in an organized format. I think a lot of times we share a patient, we're brainstorming on a daily basis. So it's cool to have kind of like an organized curriculum for our discussion. So it should be good.
I know, I'm excited. I think this might be the most we've actually sat down and talked to each other in a span of time rather than 30 seconds here and there catching each other. So
perfect. All right. So let's talk about your path. Obviously it's led you to CSP, but why manual therapy? Why chiropractic? What was the path that got you there?
I mean, definitely took a different route with everything traditionally. I grew up as an athlete, played multi-sports, and we were a big sports family. So by the time I got to undergrad at Michigan State, I kind of knew I wanted to work in sports in some aspect. I didn't really know if like the medical route was going to be you know, the combination of it all, but ended up majoring in kinesiology and really enjoyed it and working with athletes and being more hands-on, and kind of just like seeing that success and the progress from it all. So I ended up going to Cairo school over PT, just by getting some exposure to both kind of aspects and realms of the world, and thought, well, Cairo's pretty cool. It's a little different, and I think I can do a little bit more with it. At the time, physical therapy was still kind of like something that only happened in like the hospitals, or it just didn't have the biggest scope. So I went the Cairo route, and as I was, going through school, kind of realized really quickly, like there's so much more that can be added to this, I think, to make this even more successful. So we obviously learn a lot of anatomy, a lot of hands-on, a lot of palpation skills, chiropractic skills in school. But as I kind of went through clinicals and whatnot, I realized how important it was to bring in like a manual therapy aspect to it,
Mhm.
and a rehab and exercise aspect to it, and how just when you really combine those three, they really took off and you got great
Mhm.
results. So kind of went that route.
I love that. And it's interesting because when you look at your career path, like you have
Mhm.
worked across the very definition of like the high level continuum. Like you've dealt with some absolute badasses on the UFC side of things. So you see a lot of trauma. And then you've
Mhm.
gone to the WNBA where you see obviously a ton of lower extremity stuff in a female population. And now
Yep.
you come to the baseball world where you see a ton of upper extremity stuff in a male population. Like I'm not sure what the next step would be if you were going to find a fourth discipline to treat, but what's the biggest contrast that you're seeing? Obviously, I outlined some of them, but what
Yeah.
do you see in terms of the athletes you deal with, not just in terms of injury issues, but even mentalities and things like that in front of you?
I mean, all of those, all the professions that I have worked with, all the different sports have been so unique and so interesting. But I think that's kind of maybe why I get the results that I get, because I feel like I have seen it all in in different ways. The UFC was so unique because you're managing like these acute injuries, acute traumas. Most of the injuries are trauma. There's some chronic stuff in there too, of course. But the thing with those athletes is they have to fight in order to get paid.
Mhm.
And they're also independent contractors, which a lot of
Mhm.
people don't really realize. So at the end of the day, whatever they decide and whatever they want to do is up to them.
Mhm.
So if they say they're fighting, even though they've got a broken hand, they're going to fight. And there's
Mhm.
not really much that anybody else can do about it. And so, I mean, that was so interesting. And it was just such a wide variety of different injuries, and you're managing concussions all the time with that. Um, Really close to the weight cut aspect of that. So learned a lot of cool things from like the dietitian, and that whole dietitians there, and that whole world of weight cutting. And that's just a whole different topic. But yeah, and then went into the WNBA, which was completely different. Now I'm in a little bit more of a sports, or just sorry, like a team environment. So I'm dealing with front office, I'm dealing with, management, I'm dealing with agents, things like that. And the say of kind of what's happening in their progressions isn't just specifically with that athlete anymore. I've got a lot more people to deal with. And so just completely different. And for the WNBA, like our seasons, it's fast and furious. It's 6 months, it's super short, it's condensed. They have really long off seasons,
Mhm.
which maybe isn't a great thing for them. A lot of these girls are going to play overseas
Yeah.
in the off season, which are, a whole different beast to deal with, and they're not getting good care over there. So you're kind of coming back and you have like a month of a window of time to kind of get them ready for this season, and then it's
Mhm.
go. And it's a lot of lower extremity injuries and the impact of the hard floors and the shoe wear and just like so many different factors. And then obviously working with the female population,
Mhm.
those nutritional factors are coming into play, the hormonal factors are coming into play. So, couple that with just the league in itself was growing at the time. So there just wasn't a lot of great access. A lot of the teams didn't even have their own gyms at that time. A lot
Yeah.
of the teams didn't have their own performance facilities. They've got, a team of two handling like strength and conditioning, nutrition, sports medicine, and
Yeah.
equipment. Like, so it was a lot. And I had to wear
Mhm.
a lot of hats there. And in settings like that, you're not really able to like do what you know how to do best and
Mhm.
like use your whole manual therapy skill set. You're putting out so many fires, and I was in a medical director role, so I was just overseeing a lot more things, not being able to be as hands-on as I would have liked to. And then kind of moving out of that professional sector and into the private sector where I do have the time again to kind of treat how I want to treat.
Mhm.
And I also have a fantastic team that supports me. We've got, a lot of good equipment, data diagnostics in the house as well, great minds to pick from. And it's a little bit, in my opinion, kind of the best of both worlds. So,
Oh, I appreciate you saying that. What
yeah.
is it that obviously baseball players are unique, and you
Yes.
grew up around it, we're away from it for a while and coming back to it. Like, what's been the most eye-opening thing about, I'm not even sure want to say the baseball population, but the baseball world? Like, obviously, like you're seeing 13-year-old kids that are massively broken. Like it's
Yeah.
eye-opening in that regard. But I'm curious what's jumped out at you the most? What's been the most surprising?
I mean, I do think, I mean, the intensity of the parents and things like that have been, interesting to work with and, sympathetic to these kids and what they're going through. But, they're working so hard and they're doing workouts before school, then they're going to school, then they're doing workouts after, and then they maybe even doing working out with a different sport. And it's like this whole day thing. They're even doing more than the pros are doing. So that's a crazy thing for like our youth athletes that I was seeing. But I think just baseball, just coming into it again and just really wrapping my mind about the longevity of the sport and like I can get them to Saturday, but like, are we going to be able to get through the next month, the next 2 months, the next 6 months, 9 months? So
Yeah.
I went from a sport that was all year round to a 6 month sport to now like a 9 month sport. So I think just kind of managing the
Yeah.
loads of, the activity,
Yeah.
the rehab, and making sure that they're getting everything that they need so that they can recover as quickly as they need to, while also, just working with the entire team, whether it's our team or, their organization, and kind of just managing it as efficiently as we can with so many moving factors, with such a long-term season, with what they want to do in the off season, with progressing injuries or, regressing injuries, rethinking injuries. Like, do we have the right diagnosis? That's always a fun one.
Yeah. It's interesting how many times I have like this same almost like conversation with people from all different walks of the baseball world. That like it comes back to like plan your yearly calendar, like have a plan. Whether you're talking about like managing 12-year-olds to people coming back on Tommy John rehabs or just pro baseball players trying to sync up their off season. It's amazing how many people just don't really think that far in advance.
I will say I think so far the baseball world has been the best at that as
Mhm.
far as just like you're an athlete
Mhm.
365 days out of the year. Like that
Mhm.
mentality has been better across the other
Mhm.
sports that I've worked with.
Mhm.
A lot of the times with the fighters, like as soon as they're done with a fight, like they go crazy for like two,
Yeah.
3 months. And we got to the point where we were able to, really
Yeah.
educate them on, hey, you're a 24/7, 365
Yeah.
athlete. Like you can take a few days here and there, but like let's dial it back or let's, manage this to a way where you can still have a little fun, but then, time to get in gear again. And the same thing with WNBA was like there was such a long off season that it was hard to reel it back in with the
Yeah.
overseas stuff. But yeah, I mean I think one of the biggest conversations that we continue to have is load management for
Yeah,
sure.
absolutely. So you hinted at this before, like the importance of having a, collection of different skill sets. So, in the context of your daily practice, like what are the tools in the toolbox? And also why is it important for you to have more than one underneath that umbrella?
Yeah, definitely. I mean, I think like as a chiro, I mean I think of chiropractic as a tool in my
Mm.
toolbox. I don't think of it as kind of like my whole philosophy. It is like what I went to school for. But I see it as one of my tools. And manual therapy is, well, there's a bunch of tools that can come with that. There can be like it can be active release, it can be dry needling, it can be Graston, it can be cupping. There's so many different techniques and tools in that sense. Like ideally, if you can be good at a couple of them, and some people will just say one, but I'm going to argue a couple because it's just, not one size fits all with every one of these athletes. So hopefully you have a few of those in your toolbox as far as manual therapy. But then, I mean, there's just so many other things that you really need to have a good understanding about if you want to be successful in working with professional athletes or really any patients. I mean, you have to have a good understanding of exercise prescription, rehabilitation techniques, load management techniques, being able to speak to a patient, educate them, on whatever, whatever it may be, getting that buy-in from them. You're a psychologist all in one day as well. I mean, people are, hanging on the ledge all the time. You got to talk them off of it. You got to know when to refer too. You have
Mhm.
to know when to reach out to your referral
Yeah.
system. I think that's a big one that, a lot of practitioners, might not dip into enough. But I think, you have a great network. I feel like I've got a really good network. And I think that's a big reason of why, we are so successful is because a lot of the times our athletes don't live near us or we're
Yeah.
doing remote programming and we need to send them somewhere else
Yeah.
or they're over, it's over our head. We need a second opinion. And I think having like the humbleness of knowing that is really important as a
Yeah.
practitioner or a coach. And yeah, just having all of those tools and an
Mhm.
understanding of a little bit of all of those things, I think is going to make like what the best practitioner is. And that's what I
Yeah.
look for as well when I am referring out or
Mhm.
if I'm looking for a provider for some athlete in a different city or something,
Mhm.
I want them to have all of those kind of at their disposal
Yeah.
and being able to communicate with those.
Isn't it wild how the longer we've been at this, the more likely we are to refer out? It's like you ask for help, but more targeted, intelligent help. Like you know exactly where to send them and all that. Whereas I think as young practitioners, you want to just like take on the world.
Yeah, I think,
Mhm.
yeah, that's probably so. I probably tried to, do more
Mhm.
than I probably could have at some stage of my life. But I think, I mean, that's just the beauty of, I think being in the game and being humble and asking good questions
Mhm.
and getting that network, because at the end of the day, we just want what's best for the
Yeah.
athletes, right? So if I know a guy who can do something better or, read a better MRI
Mhm.
report than me, I'm going to send them their way and get that input because I trust that provider um, and I think the athlete trusts that as well if they're
Mhm.
like, hey, like if you're just honest with them about that kind of thing. So
Absolutely.
you
Let's
give feedback.
But we actually just probably hinted at one, but what are some of the common mistakes that we see specific to the manual therapy community? Like, I'll say the first one is just not doing it. Like we saw an athlete literally today who's 20 days post-op and has had zero manual therapy, no like skin rolling, no anything above and below the joint, just hasn't been even touched. But what are some of the things that maybe jump out at you, like when you see people who haven't had good results, and you kind of jump in later and you have the benefit of hindsight?
Yeah, I mean, I think you hit the nail on the head. That's definitely like one of my top ones is just not getting manual therapy, especially with a post-surgical patient.
Yeah.
There's just no excuses for it. I mean, I had a soccer player and 18-year-old who was going to go play in college and was in her 4 month of physical therapy and had not gotten any manual therapy and didn't have full extension in her knee. And it's still happening out there to this day. And that's just a really sad thing to see. I mean, so yeah, that's a big one, knowing, making sure you're getting that. Hopefully it's good or what is good and you're looking for it
Mhm.
and you're seeking that out. Um, I think a big one too is just the lack of, integration with rehab or progressions and on the strength conditioning floor. And that probably targets more of the chiropractors that I see in their realms, right? So they're doing a lot of manual therapy, but maybe they're not getting the right rehabilitation program, the right
Yeah,
strength program to follow up with the manual therapy as well. So, I mean, it has to be both. That's how it works the best. I mean, there's cases where one is enough, but I think it's rarer and rarer, and you can always argue that having them both is going to be kind of the best.
absolutely. So speaking maybe with respect to manual therapy, obviously as part of your entire overall approach, like I'm always fascinated when I get around other practitioners and I watch them do an evaluation, right? I listen for the questions they ask, like where do they begin? Like what's the roadmap? I'm curious, like where does your evaluation begin when you get a new patient who walks into your office?
I mean, I think the first and foremost is just listening to the patient. Like, hey,
Mhm.
what brings you in? Tell me all about it. I want to hear everything from like your viewpoint, right? Because I've already been briefed normally with
Yeah,
from you or the
yeah.
parent, the strength coaches or whatnot. But it's really always so interesting, like what that athlete has to say
Mhm.
and where they're coming from and I think also what's important to them. Like, what are their goals? What are they feeling? What do they want to get back to? I think those are really important questions to ask, but I mean, a lot of the time that history is going to tell me like 80-90% of what I need. And if you take a really good history and you really are actively listening, a lot of the times you have a really good idea of where to start or you already know where you're going to go with it. And then, going on from there, obviously, like for me, tell me what hurts, tell me what movements, let's
Mhm.
check it, let's go through
Yeah.
movement screens, let's go through, of course, our neuro and ortho testing. Let's go through provocation and relief testing, like what hurts, can I make it better if I manipulate here or there. So it's a lot of like testing and retesting
Mhm.
in my eval as well as in my treatments. um Imaging's great, but it
Mhm.
rarely tells me the full picture,
Yeah.
as you know.
Yeah.
For me, structure does not always equal function. So I'm going to take that and put it in my back pocket,
Mhm.
consideration of imaging, of course, but it's just going to tell such a different picture when you get that person in front of you moving around. So it's a good adjunct, but it's not everything to me.
I like that. That's maybe a good place to go. I'm going to jump around to a later question here just because you piqued my interest. So like let's take that and like speak more specifically. Like I've actually enjoyed all our interactions, but in particular, like just hammering home, like, man, we had a college low back, I think, when one of your first weeks here that came in and like egregious misdiagnosis, showed up way more symptomatic than we thought he was. And he wound up having a bilateral spondy that needed some screws put in it. And so it was I think a good eye opener, and we did right by the kid. And so we've had these good discussions about both acute and chronic low back pain. So let's talk about how we're attacking those, right? So let's say you get acute low back. It's a guy who throws out his back deadlifting. How are you approaching, he hobbles into your office, both the evaluation and the treatment. Is there like a roadmap that you have in your brain for something like that?
As a friendly reminder, this episode is brought to you by Mark Pro. It's a cutting edge recovery tool that provides all the benefits of active recovery, but without the extra effort, muscular fatigue, or stress to the joints. This is something that's a huge hit with our athletes at Cressey Sports Performance, and I use it absolutely every day. If you're looking for the same results that these athletes get, visit markpro.com/baseball and use coupon code Cressey at checkout for an exclusive discount.
I mean, yeah, absolutely. I mean, first and foremost, obviously, you want to rule out any of those red flags,
Yeah.
right? So you want to perform all of your standardized tests and you want to do your neuro and your ortho testing. And I think really even diving into that's a whole nother thing because I feel like a
Mhm.
lot of practitioners, they go through their orthos and they go through like their little flow chart in their textbook and
Yeah.
then they skip on neuro
Yeah.
like big time and they miss stuff.
Mhm.
And that even went into like our assessment with that,
Yeah.
like that initial athlete we were
Yeah.
just talking about that came in, right? Is something just wasn't right. The way that he should be moving didn't add up to the test. And once I dove into neuro a little bit more, I kind of realized it was like a different kind of disc instability thing that we were talking about, right? So rule out those red flags, make sure you're doing a good neuro screen, and then obviously figure out what happened, clarify the mechanism of injury, assess the movement
Mhm.
tolerances after that, like what can they do, what can they not do,
Yeah.
see where you're at there. And then, I mean, from there, I obviously think manual therapy is like a great way to put the fire out, so to
Yeah.
speak. And I think it's really great in the beginning of those acute low back cases because they really can't do much on the gym floor, right? You got to put that fire out first. And then, really just progressing. And I tend to treat a little bit more conservatively, but obviously if there's a big red flag, we can refer out to imaging.
Mhm.
But maybe if that's not needed yet, we can, go through the manual therapy world and then progress them out to, the strength floor and go through those rehab processes. Basically got to figure out what got him there in the first place,
Yeah.
what movements were, what was he doing? What were they doing? How do they overload in a way that got them hurt? I think after we kind of figure that out, there's a space for like a deload process of that and then reload, right? And
Yeah.
just kind of figuring out and getting them exposure to those correct movement patterns and re-educating the patient for that like long-term success.
How does it change if you're seeing someone who's chronic, right? Acute, it's put out the fire, in your own
Yeah,
words. Obviously,
right.
you want to get some symptomatic relief and,
Yeah.
reduce some of the spasming. But when you get that person who's felt like that for 4 years, it's a very different, kind of dynamic. So does it change your screening process? Does it change, how proactive you are with certain things versus others?
It doesn't change like my screening process because I think a lot of the times with patients like that, it's almost good to do a thorough exam.
Mhm.
And a lot of times what I'll hear and my feedback from those patients is like, wow, like my other doctors never have done this before.
Mhm.
Like the more like a lot of the times if you do a really thorough process and you're just kind of like reassuring them, talking them
Mhm.
through, like, really letting them understand what you're doing, building that trust, that's what that first visit's all about, especially
Mhm.
with those chronic back pain patients that have probably seen a million doctors. They've got a lot of psychosocial layers
Mhm.
and fear around their injury and their movements and what they can do. So the manual therapy aspect, the rehab aspect is important in that, and it's going to help them, but it's never probably going to be the full answer. I mean,
Yeah.
there's one off, of course, there's one offs all the time, but I mean, there's just so many layers to chronic pain. I mean, it can be tied to like an emotional episode. It can be coming from organ system issues that have been
Mhm.
overlooked for systemic inflammation issues. There's the whole female aspect or
Mhm.
hormonal issues and things like um, cysts or
Yeah.
endometriosis, things like that. Like it's so big. And the best as a provider, as a musculoskeletal provider, like you can again add that, bring in your expertise, help them however you can, but like don't forget to get the other things involved and look at
Yeah.
all of these different aspects and make referrals and things like
Mhm.
that when you think it's important.
What's your biggest indicator for referral? Right? What's the stuff that goes, is it radicular symptoms? Is it like what tells you, because we both know you get a lot of imaging right off the bat on an acute low back, you can start barking up all the wrong trees, right? We look at any oblique strain MRI in a pro baseball player, and you're going to see at least one spondy in the background. They've all got them.
Right.
These things are just rampant. Everybody's got discogenic stuff on imaging, but not
Mhm.
everybody has stuff that lines up with their symptoms. So do you have an algorithm in your brain on what you will send out, or is it totally case by case and it's just when things don't line up and you need more information?
I mean, I think first thing off the bat is, yeah, if there's something traumatic, if there's a red flag, if there's a gut feeling, like I'm just going to refer out right away because
Mhm.
you just have to cover yourself. You have to do what's
Yeah,
best for the patient. Like just go ahead, get that image. That's what the red flags are there for, to
yeah,
go through that referral pattern. But then after that, it's just I tend to treat more conservatively, but I'm really honest and I'm to the point where like if I'm not seeing any progress, we're getting an image or a
yeah,
referral. And that could be after two treatments, one treatment, three treatment, five.
yeah,
I don't like it totally depends, right? And
yeah,
until I really stop seeing progress or I see regression, obviously, if I see any neurological regressions, of
yeah,
course, we're gonna keep going. And if there's 1% progress or something,
yeah.
I'm gonna keep going. It's slow, it might be slower than normal for some people, but as long as I'm seeing that, like I'm okay with it.
Mhm.
The other situation that comes into mind is just if for some reason that athlete isn't like buying in or
Yeah,
they're continuing to ask a lot of like fearful questions, like you want to get this for a peace of mind, let's do it. No
yeah.
problem. Like, there's that factor too.
Yeah. I think the other one I think about a lot is chronicity. Like how long has it been going on? And when you get that person that's seen three other practitioners and it doesn't add up, it's almost like, well, maybe they've been treating the wrong diagnosis all along. We see a lot in elbows, right? In the baseball world
Right.
where a ligament looks pristine on an MRI and they do a fever view, to stress test it and the thing gaps way too much. It's a ligament that's overstretched. So like I think I've done that way more. It's just referred out just to like it's kind of peace of mind for the practitioner as much as it is for the actual athlete, just to know that the diagnosis is actually accurate. So you're working from the correct starting point.
Yeah, that's completely true. And I mean, how many times have we had this problem already where we're getting like a radiology read that we're like, that just doesn't add up. Let's get someone
Yeah.
else to read this, and it's completely different. And then we get a third one, and it's completely different. So I think, yeah, with us going through our exams, our gut, with our experience, looking at what they're coming in with, maybe we do need to get an image or an updated image on something.
Yeah.
Maybe it's been a while. Maybe they've had the image, gone through PT, nothing changed. And then it's like, okay, well, were they really working on the wrong thing? And in that case, like for me, it's like, well, let me do one or two treatments and like
Yeah.
see where I can get. And then at that point, if really nothing's changing, then like, okay, well, yeah, we're definitely gonna get another image, see what's going on and cover our bases.
I love that. Since it's a baseball podcast, let's talk about common baseball presentations. Like
Yeah.
what's something that you see missed the most in this world?
I think two things so far, and it's only been a couple, 4 or 5 months now, but I think the two things is like not checking the full kinetic chain.
Mhm.
So a lot of times, like obviously with elbow pain, like it's we're getting into shoulder, we're getting
Mhm.
into neck, could be opposite hip, could be
Yeah.
opposite ankle,
Yeah.
like so many different avenues of where that actually pain is coming from, originating from, that might
Mhm.
be showing up in a different area.
Yeah.
And then the second one is, I think, the misdiagnosis of nerve entrapments as like
Yeah.
strains or sprains. Like I'm finding it on almost all of these guys. And it's, with the combination of some manual therapy and some neurodynamic interventions, like these things that were quote unquote sprains and strains are clearing up in a session
Yeah.
or two. So I think those are like the two biggest things I'm seeing so far, and I'm getting pretty good results going
Yeah.
down those routes. It's been fun.
That was one case study that kind of actually fits with both of those. We had a pro baseball player that came back, and you probably know who I'm talking about, who
Mhm.
was a 40% asymmetrical shoulder external rotation strength at 90 degrees of abduction. Literally just terrible 2 manual therapy sessions, and they were symmetrical. So it's, you can call it kinetic chain, you can call it nerve entrapment. It's probably a little bit of both, but I know
Sure.
for me personally, treat my neck and my shoulder magically feels better. So I do think the neck has been overlooked so much in this population. So it's good to see it getting some love.
No, I agree with you completely. I'm finding myself as the weeks goes on, like kind of just creeping my way up to the neck on almost every visit. And it's not that I've gotten away with it, but it's something that's interesting as like my full like background and everything that I've started with, like everything comes from the spine, right? Like as a chiropractor, it's kind of what we're taught. So it's just interesting to see like how much I can really affect the upper extremity or lower extremity when I hit that as well.
Love it. All right. So now we're going to go out and we're going to have a broad brush that'll probably get some people feisty on the internet. So there are people out there who like to argue on, Twitter, Instagram, wherever it is, they like to go argue that they say there's not enough compelling research to support that manual therapy is effective. I always joke that it's been on cave paintings for like 5,000 years. Like they wouldn't have painted about it in ancient times if massage didn't feel good and work. But what would your response be to people that, they say, hey, there isn't a clear mechanism of action. What is it that you think is actually happening when you treat somebody?
Oh, just a loaded gun you went with.
Yeah. We're opening a big can of
I,
worms for 9:15 at night.
I mean, I think I just, I know what the research says. I know what the evidence says that there is no really research that shows any limited long-term benefit of manual therapy on its own, right? But that's not what we're doing like at Cressey or in my world, right? We're adding it into rehab, and we're adding it in to with adjustments or
Yeah.
with the different things, with different all of these different factors, right? So I mean, you at the end of the day, like someone can't argue with me if you like if I'm seeing less pain, if I'm seeing
Yeah.
better range of motion. I mean, if I'm seeing improved tolerance to activity, there's something that's happening there.
Mhm.
And is manual therapy like the end all be all? No, but I think it does like open the path and
Yeah.
open a window to let us go down to start like rehab sooner, for tissue healing to happen, for neurophysiological mechanisms to happen in the body. I mean, it does show, I mean, studies that have said it's increased mechanical receptor
Yeah.
input, things like descending inhibition.
Mhm.
And I think also just there is something about just like putting your hands on someone.
Yeah.
Like there's a trust that happens. There's a relationship that gets built.
Mhm.
It's psychosocial. Like
Mhm.
it's just how really about the technique, it's how you integrate it into like the bigger plan.
Mhm. I always think about too, and I was a case study for this because I was the demo guy at a fascial manipulation course, and I got
Ouch.
beaten up pretty good over but I felt amazing a week later, and I think that
Right.
happens a lot is people got off the table and maybe they actually might even feel a little bit banged up from the treatment. So they don't really know if they feel better, but then 3 or 4 days later, it's magically improved. I think there is something to be said about it. It's almost like letting the lymphatic system do its job. Like we're getting fascial layers to glide, we're changing fluid balance in the tissue and just reallocating things. So I think it's hard because it's not an easy transient study that you can do beyond just range of motion.
Yeah, I mean, honestly, that's a really good point, and something that even like works back to one of our previous questions that we were talking about like kind of common mistakes in manual therapy, I think. Like I think these techniques like really hone in on like, oh, we're working on the muscle
Mhm.
and we're working on the fascia. And they don't really realize actually like how many other systems we're affecting. Like we're affecting the parasympathetic
Mhm.
system, we're affecting the systemic system, the lymph system, the vascular system, neurosystem, organ
Mhm.
system with manual therapy. And then I think also just if you get a practitioner that can like understand all of that, and like take into the location of those things, making sure they're all working together, nothing's, there's no clog, they're all aligning. I think that's something I do, and I take all of it in consideration, and I see that big picture, and I think that's, why I get pretty good results in my treatments.
I love that. All right, so we always wrap up with a lightning round. These are you can be as quick as you want with these responses, but we're gonna throw them out there. So the first one, we have a lot of rehab specialists or aspiring ones that are listening to this podcast. What recommendations would you make to them if they wanted to become proficient manual therapists? What's your algorithm for improvement?
I mean, I think the first thing you really have to do is like be really good at your anatomy, be really good at your palpation. So get the fundamentals down. Know how to do a really good exam, a really good assessment, know how to listen and take a really good history. So get those things out of the way. You're going to be better than 90% of the population first. But then also like you have to take these continuing education courses. Like they're expensive, they're time consuming, but like you have to take them in order to figure out what's going to work best for you, what you jive with. You have to have a few of them in your toolbox. Like, I don't care what you want to pick, if it's like active release versus fascial manipulation versus cupping, scraping, like you have to have a few different tools, right? It needs to be there. It's non-negotiable, especially if you want to work with the highly or elite athletes because they're expecting it because those guys are already getting it. So I think it's really important to figure out like what the people you aspire to be like. And that was something I always did is what have they taken? What are their techniques? What are they into? What's the new thing? What's the most evidence-based? And I think go from there and like just start taking these courses, start learning, start investing in yourself. And that goes across, I think, any profession. Like
Yeah,
investing in yourself, you're never going to go wrong.
absolutely.
Also, just like finding, yeah, and just like being open-minded, being hopefully evidence-based, getting, being able to take feedback and grow from that too.
I love that. Now, on the flip side, if you're a patient, how do you find a good manual therapist? Where do you look? What do you look for?
I mean, I think patients and well, anyone these days with social media, like there's just so much more available to good and bad, but obviously
Mhm.
can also steer you in the wrong direction. So having that as like a tool in your toolbox to be able
Mhm.
to like see what you vibe with. If you're
Mhm.
finding someone on social media who like looks like they might be able to help by the education that they're putting out, some of the exercises they're doing. I mean, you can kind of go look at their website, see
Mhm.
what courses they've taken, techniques they've taken, and you can maybe find and research those techniques in your area to try to find someone. Also, like look around you. If you're in a big city, if you're in Detroit and you've got four
Yeah.
professional sports teams, there's probably providers that are seeing
Yeah.
those athletes. Where are they?
Mhm.
Like that's a good place to start. Kind of just trying to find, I think, people that you would want to treat you and
Mhm.
be okay with that and not just kind of settle for someone who's close to you. Really try to find the best of the best for yourself because
Yeah.
everyone deserves that.
I always this is my random aside pet peeve is like when I'm trying to make a referral to somebody and you'll go to like a provider locator website and you'll cross-reference a couple of them with the same zip code and you come up with somebody and then you go to the website and it's like Dr. Smith is a accomplished triathlete and enjoys walks on the beach with his wife and three dogs. And it says nothing about credentials, like what clinical skill sets he has. I understand it's like very patient focused, but when you're actually trying to make a referral, I always tell people make expertise easy to perceive, like across a bunch of different mediums. Some people want to talk to you. Some people want to come visit your office. Some people want to read an article you wrote. Some people want to look at your credentials. You have to make it easy for them to see. So, sorry,
That's
my
yeah, that's
soapbox.
really important for sure to put that up on your website if you're wanting to treat certain kinds of
Yeah.
patients.
All right. So what's something you've changed your mind on over the past year?
I think this comes back to just the worlds I've been in that's been like go, go, go with like the rehabs and like we're pushing through and like it's game time. You got to show up. I think I'm probably getting with this population, I've seen the importance of like being more conservative
Mhm.
in some ways, or because I'm dealing with just like such this like long term of a sport now
Yeah.
that I have to look even more ahead than I ever have to. So it's really about I've been able to kind of slow down, question myself, and being able to find the right recipe to like push it because I think
Mhm.
there's times for that for sure. But also knowing to kind of like, okay, you're right. We have to dial it back. We have to go
Mhm.
slow. We've got still 4 more months kind of thing. Like, and respect now me working with athletes that are also have an organization versus me being in
Yeah.
private versus me being right next to the in the front
Yeah.
office kind of thing. So
Yeah.
yeah,
It's always important to kind of you're treating the person, the timeline, and the sport, and not just the
yeah,
injury. It's a tricky dynamic to
yeah. I
have
think
all
that's a
those
good
things in
way to
there.
put it.
Love
Yeah.
it. What's something that excites you the most right now? What do you
I
think
mean,
about as you're staring off into blackness, like in this world of sports medicine?
honestly, like just diving into a new sport for me, well, I
Mhm.
mean, new and old in a
Yeah.
way, but diving into a new sport and seeing what the impact I can make here. I mean, we've got such a phenomenal clientele, and I mean, I think I'm helping, and well, I think
You are. You are.
yeah, right. I think I'm helping, but I also am now thinking of like, okay, how much that other people like need to see what's going on. And I
Mhm.
think I'm at a point in my career, like over a decade in, that it's time for me to, like start teaching and start
Mhm.
like getting out there and
Mhm.
like telling people what I'm doing and like how I'm helping and figuring these things out. And whether that's the chiropractic world or
Mhm.
just all sports medicine
Yeah.
world, I think there's a future of being able to like give back and teach
Mhm.
and to just kind of help other practitioners
Yeah.
if with some of the stuff that I'm seeing. So
That's exciting stuff too, because the more you teach, the more you have to like organize your thoughts. Like that helped me a lot, writing and speaking.
yes,
Like I was
yes.
always like word, alphabet soup. So it slowed me down and basically forced me to be a little bit more concise with my thoughts. Well, this was fantastic. You've been an absolute difference maker at the facility. We love having you. So
Thank
it's
you.
cool to be able to share your wisdom with a larger, group out there. So thank you for taking the time.
Well, thanks so much for having me, and it's been so much fun, and keep crushing it.
Right on. We will see you tomorrow.
See you tomorrow.